I'm Sarah Marquis. I'm a medical technologist at Biomere. I have been a medical technologist for the past 10 years now.
Hi, I'm Carrie Jo Kelly. I'm a medical technologist too.
For a typical day, between the three med techs, we rotate departments, being chemistry, hematology, and lab support coag. For clinical chemistry, that one has a much broader range of analytes that we can look at. For example, kidney function. And we will provide information such as BUN and creatinine levels to make sure kidney function is going the way it's supposed to. So we'll get that information off of our chemistry analyzer and we'll be able to relay that so they can monitor how it's going, if they need to adjust anything on their treatments, running daily maintenance, making sure my QC is good to go, prepping for any studies that are oncoming for that day, looking ahead.
And then we will share those reports as the study is going along at each time point with the study director. So they have live data going as their study is developing. Some clients don't test all three disciplines within the lab that we offer. Some just want chemistries, some just want hematologies. It just depends on the nature of their TA or their study. But you can link the results from, say, a CBC analysis, which is all of your cells and the aspects of the cells, that all the characteristics that we're telling them from the results. You can link that sometimes to the chemistries as well, especially if there's abnormals. You can see the state of the body or the state of the systems in the body throughout all of the disciplines, because sometimes those increased results or those abnormal results will tell a story across the entire picture. And it's very interesting to see, because we will look at all of those and we will put that picture together ourselves, which we enjoy seeing, just because it helps to correlate those results and know that your results are on the right path and giving them what they need. And it is very helpful, especially when an animal is failing and they need to see that whole picture and make a decision.
The main aspect with coag is it's the study for blood clotting. And you're looking at the different pathways for the coagulation cascade. Could go more detailed, but in the summary of it, you're making sure that the body is able to clot appropriately, and that there are no deficiencies in any factors, and that the products that are being made are being taken care of appropriately. This is with like the 4 basic tests that we do, which is your PT, PTT, D-dimer, and fibrinogen. And we brought that on because we've noticed that a lot of clientele does look for that, and I think they use that for helping, especially with monitoring certain drug therapies, to make sure there is no clotting interference going on. And it helps them see a better picture of like what exactly is being affected or what is safe